heart and circulation 1. Shortness of breath. Shortness of breath or breathlessness is dyspnea. At first, this is caused by exertion, physical activity such as climbing stairs, but in severe cases it may be present even at rest. A patient who is breathless when lying flat or somnia, for example, in bed, will tend to sleep raised up on two or more pillows. The abbreviation SOBOE stands for shortness of breath on exercise or on exertion or on effort. Patient says, I get terribly short of breath climbing stairs. Doctor can ask, how many pillows do you sleep on? Heart rate. The normal resting heart rate is 65 or 75 beats per minute. In athletes, it may be as low as 40 beats per minute. In street athletic activity, the heart rate can go as high as 200 per minute. The heart rate may be regular or irregular. In a irregular rate, arrhythmia, there may be early beats which interrupt the regular rhythm, premature beat, or the rhythm may vary with respiration, or it may be completely irregular, as in fibrillation. When the patient is not aware of irregularity, they describe the symptoms as palpitation. Case 4. A 22-year-old student was admitted to the hospital with a long history of heart problems. She had been increasingly tired with shortness of breath on exertion, orthopnea, and palpitation. A mitral valve replacement had been carried out 3 years previously, and this had stabilized the symptoms of heart failure but was followed by episodes, attacks of atrial fibrillation, which had been particularly severe for the 6 months before admission. Heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output. The amount of blood pumped by the heart each minute from the body's needs. It may involve the left side of the heart, the right side, or both. In left heart failure, the main symptom is breathlessness. The symptoms of right heart failure include peripheral edema, swelling, beginning in the feet and ankles. This is known as pitting edema. If when a finger is pushed into the swelling, it causes small depression or pit. Aorta, tricuspid valve, septum, mitral valve, pulmonary veins, pulmonary artery. Exercise. Complete the conversation based on the case history in B opposite. What seems to be the problem? Patient. I'm been getting. Doctor, how long have you had them? Patient. For 6 months. But I have had problems for years with tiredness and in the end it couldn't walk more than 100 meters without having to stop. I had to sleep or 3. I had a replacement 3 years ago and that improved things for a while. Make word combinations using a word from each box. 2 words can be used twice. Look at B and C opposite to help you. Add atrial, cardiac, heart, and beating per meter. Output, failure, edema, fibrillation, beats, effort rates. Write the words a patient will use to describe symptoms below. Dyspnea, arrhythmia, or nea of edema. Complete the case report. Look at A, B, and C opposite to help you. A 60-year-old woman attended her GP surgery complaining of breathlessness on. This has been increasing over the previous 8 months until it was producing problems at around 500 meters walking up the level. There was no history of chest pain. She had had several of fasts which lasted 20 or 30 minutes and were associated with some of breath. She has noticed some of her ankles by the end of the day disappeared overnight.